Welcome to Chapter 7, Lifespan Development. So in this section, we're going to be exploring how human beings change physically, emotionally, and socially throughout their lives. And more importantly, how those changes influence the way we assess and care for our patients as EMTs. So whether you're treating a neonate in respiratory distress or assisting an elderly person who feels lightheaded, understanding the age-specific differences of anatomy, physiology, and behavior is really essential to providing competent and compassionate care. So each stage of life brings its own unique challenges and considerations. And by the end of this chapter, you're going to be better equipped to recognize those differences and respond appropriately. So this chapter really helps connect the science of human development with the real world situations you'll face in the field. So as EMTs, we operate within a framework of, again, national education standards designed to prepare us for the wide range of situations we're going to encounter. Okay, so this chapter aligns with two major components. First, we always have the preparatory standard, which really ensures we understand our own role in the EMS system, including the importance of safety, legal responsibility, and ethical conduct. And second, the lifespan development standard. Okay, so this focuses specifically on applying our understanding of human growth and development to patient assessment and to treatment. These standards aren't just academic checkboxes. They really shape how we engage the people or engage with people in moments of crisis and determine whether we provide the right care at the right time. And this is largely based on the patient's age and developmental needs. So, in practical terms, this really means that you need to know what's normal and what's not at each of these stages of life, from the rapid growth of infants to really the emotional complexity of adolescence, all the way to the physiological slowdowns that come with aging. Your ability to recognize age-specific patterns can mean the difference between catching a life-threatening condition early on or missing those subtle warning signs. So you'll learn how to adjust your assessments, how to interpret vital signs in specific contexts, and how to communicate effectively with patients of all ages. So again, whether you're working with a little curious preschooler, a rebellious teen, or an anxious older adult, the goal here is simple. It gives you the tools to approach every patient with confidence and competence, rooted in a solid understanding of human development. So let's begin with the big picture. Okay, human development itself is continuous, right? And as medical providers, it's important to understand the physical and the psychological transitions that take place from birth all the way through old age. So these changes directly impact how we evaluate our patients and make decisions about care. For example, an infant's respiratory rate of 60 breaths per minute is completely normal, but that same rate in a 40-year-old would be a medical emergency. So we really have to calibrate our expectations and our care. And this is all based on age-specific norms. So this chapter really lays the foundation for doing just that. So starting with vital signs, and in general, the younger the patient, the faster their pulse and respiratory rate. And as people age, those rates slow down while their blood pressure gradually rises. So as we move through each age group, we'll not only look at the numbers, we'll also examine what's going on physiologically and emotionally that really cause those changes to occur. And that context is everything when it comes to accurate assessment and effective treatment plans. So when we talk about neonates and infants, right? So we're referring to really the earliest and most rapid period of human development. A neonate itself is a newborn, okay? So from birth up to 1 month old. An infant is 1 month to 1 year of age, okay? In these first 12 months, the human body really undergoes some of the most dramatic growth and changes it ever will. So understanding these rapid changes is crucial because they shape really how we interpret signs and symptoms in the field. For example, a breathing rate or heart rate that would concern us in an adult might be totally normal in a newborn. So we have to reset our really clinical expectations when we treat this patient in these different age groups. So these neonates and infants, these patients are small, right? But the impact of our care can be massive because their ability to compensate for illness or injury is very limited. And things can go downhill quickly if we don't act appropriately. Um, so, so with that being said, let's kind of talk more about the infant themselves and the neonate. Let's talk about weight and growth. So two of the biggest real indicators of health in infants. A neonate typically weighs between 6 to 8 pounds at birth, with their head making up about a full 25% of their total body weight. That disproportion has important implications. So when they fall, they tend to land head first, really increasing their risk of head trauma. During the first week, babies actually lose about 5 to 10% of their birth weight due to fluid loss, but then they begin to gain it quickly, about 1 ounce per day. By 4 to 6 months, their weight should double, and by 1 year, it should triple. Okay, this rapid growth really reflects major internal development, from muscles and bones to organs and immune function. So as EMTs, understanding this baseline really helps us catch red flags. So if a baby is well below or above expected weight for their age, we need to consider dehydration, failure to thrive, or even abuse. It's a reminder really that sometimes a number on a scale tells a much deeper story. So now let's go into the cardiovascular and pulmonary systems of the infant. At birth, a dramatic shift will occur. Okay, the baby transitions from relying on the mother's placenta for oxygenation to really breathing on their own. And this is no small feat, right? Their first breath is so powerful and critical, facilitated by pressure changes during the actual delivery. So from that moment on, their lungs, which have never been used before, must inflate and function independently. Infants, especially those under 6 months, are nose breathers, okay, which makes them especially prone to nasal congestion and upper airway infections. You combine that with their larger tongues, smaller airways, and softer, more flexible trachea, and you got a setup where airway obstruction is much more likely than it is in adults. So when you're assessing an infant, you really need to pay close attention to their breathing pattern. Belly breathing for this patient is normal, but retractions or nasal flaring are red flags. Also remember how fragile their lungs are. So when ventilating with a bag mass ventilation device or BVM, we really need to be incredibly gentle. Okay, overinflation can cause barotrauma, which is a condition where too much pressure will damage the lungs. And it really only takes one forceful squeeze to cause serious harm. So it's really something you need to look out for. When it comes to the patient's nervous system, right? So infants might seem helpless at birth, but they're actually born with several specific and important reflexes that actually will help them survive. One of the first ones is called a Moro reflex. It's also known as the startle reflex. So in the infant, when the infant is suddenly surprised, like by a loud noise or a sudden movement, you'll see them throw their arms out and spread their fingers and then retract their arms, kind of as if they're grabbing something. It's almost like they're trying to cling to safety. Okay. Then there's the palmar grasp reflex. So if you place something in their palm, they're going to instinctively grab it. Okay, so it's really incredibly strong for their size. Then we have the rooting reflex, and that's going to help them find a breast or a bottle when something touches their cheek. The sucking reflex kicks in when their lips are stroked. It's like a built-in feeding response. These reflexes are all helpful not just in development but also in your assessment. Okay, so if they're absent or diminished, that can indicate a neurological issue or delayed overall development. Now let's talk about the fontanelles. Okay, so this is a very important aspect when we're assessing infants and neonates. So those are the soft spots on the infant's skull. Okay, so they exist because at birth the bones of the skull haven't fully fused together. The flexibility helps the baby's head pass through the birth canal and allows room for the brain to grow very rapidly during the first year. The posterior fontanelle, located kind of towards the back of the head, usually closes about at the 3-month mark. Then you have the anterior fontanelle, and that's at the top of the head, and that closes a little bit later, typically around 9 to 18 months. As EMTs, fontanelles give us vital clues. A sunken fontanelle may point to dehydration, while a bulging one could actually indicate increased intracranial pressure. So you don't need imaging to get that kind of insight, just your eyes and your fingertips. And remember, when handling infants, especially those younger than 1 year, you really want to protect the head. Okay, that soft skull and rapidly developing brain are especially vulnerable to trauma. And again, they have no real musculature in their neck, so always want to support their head at all times during your assessment. So here we can actually see the anatomical view of the fontanelles. Okay, so again, those soft open areas on the infant skulls. So what's really critical to remember is that they're not just developmental quirks. They're kind of clinical windows into really what's going on inside, right? So if a parent tells you that their baby seems unusually sleepy, irritable, or has had poor feedings, and you also see a depressed fontanelle, you should immediately suspect dehydration. Likewise, if a baby had a fall or is showing signs of altered mental status, and the fontanelle is bulging, now you need to consider the possibility of brain swelling or bleeding. So this isn't just, again, it's not just academic, it directly impacts your pre-hospital decision making, okay? Being able to assess these real subtle signs can help you catch a serious problem early on and make the necessary arrangements and treatment decisions. So now let's focus on developmental milestones, okay? And let's kind of go straight to the nervous system. So even though an infant is pretty limited at birth, they can't roll over, they can't hold their head up, or even see more than like a foot or two in front of them. Development moves rather quickly. So by around 2 months, infants begin tracking objects, recognizing familiar faces, and at 6 months, most can sit up with some support and begin to babble. Okay. By 12 months, many can walk with minimal assistance and will respond to their actual own name. So these aren't just like really adorable moments for us parents. They're really important indicators for us as healthcare providers, right? So if we respond to a call involving a 10-month-old who isn't sitting or making any sounds, we need to ask more questions, right? Is this normal for them? Has there been a delay? Remember, EMS often plays a role in recognizing developmental abnormalities, especially in communities where follow-up care is kind of inconsistent. So now let's go ahead and shift into the immune system, right? So remember that infants aren't actually born with a fully developed immune system. Initially, they actually rely heavily on what's called passive immunity, okay? This is when antibodies are passed to them from the mom inside the womb, okay? So this is also further strengthened if the baby is breastfed because breast milk continues to provide antibodies that help fight off infections. However, as those maternal antibodies kind of wear off and the infant's own immune system begins to develop, they become more susceptible to illness, especially viral infections like cold, mild respiratory kind of bugs and viruses. So this vulnerability is why EMTs and EMS is often called when a parent notices a fever or poor feeding or just lethargy, symptoms that can really be more serious in the infants. So in these situations, even subtle changes should really raise your index of suspicion. So unlike older patients, infants don't compensate that well and their condition can decline rapidly, okay? So early recognition, rapid transport is always going to be the key for this patient population. Um, Now let's kind of go into the psychosocial development, okay, for our neonates and our infants. So this begins from really the moment the infant is born. So babies start to learn about the world by just interacting with it, right? And those interactions really shape how they relate to people. At first, they respond kind of reflexively, By just a couple months in, they really begin to recognize familiar faces, tracking movement, and this is a critical part of really their emotional development. By 5 to 7 months, they begin to distinguish strangers from family members, and by 8 or 9 months, most can actually sit alone and even play like simple games like peekaboo. These interactions help develop emotional security and attachment, right? And which set the stage for social behavior later in life. In EMS, we sometimes forget how much a child's development is impacted by their environment, even before they can actually speak. So when assessing an infant, you really need to pay attention to how they react to their caregiver and how the caregiver responds. That dynamic can actually offer you clues about the child's well-being, both physically and emotionally. Um, Now, to continue on this thought, crying, right? Crying is actually the primary method of communication for an infant. But not all cries are the same, okay? Parents will often tell you they can differentiate between a cry of pain, hunger, frustration, or fatigue just by the sound, okay? So that's not just instinct, it's actually, it's developed pattern recognition, right? So for EMTs, that means taking a moment to ask the caregiver how the current behavior compares to the child's usual patterns. A new high-pitched cry, that might indicate an increase in intracranial pressure. Okay, a weak or absent cry, that could be a beginning sign of fatigue, hypoxia, neurological compromise. Also be mindful of bonding and attachment. So secure attachment develops when caregivers consistently meet the child's needs, providing a kind of a safe base for the infant to explore. On the flip side, infants who've experienced rejection or inconsistent care, they actually may show signs of anxious or avoidant attachment. And that has long-term consequences for their emotional health. So your job isn't really to make a diagnosis, right? But to observe behavior and then report your concerns when something feels kind of off. So to wrap up our discussion on neonates and infants, so we really have to understand the concepts of trust versus mistrust. So which is the first stage of Erickson's theory of psychosocial development? This phase really spans from birth to about 18 months. So during this time, infants are entirely dependent on their caregivers for food, comfort, hygiene, emotional support. So when caregivers respond consistently and lovingly, infants learn that the world is kind of a safe place and that people can be trusted. But when caregivers are inattentive, inconsistent, emotionally unavailable, the infant may develop a deep-rooted sense of mistrust, which can impact emotional development well into adulthood. So in the EMS setting, we might see this show up as a child who is inconsolable, extremely withdrawn, afraid of touch, especially if there's any history of neglect or trauma. Understanding this framework really helps us approach our youngest patients not just with clinical skill, but with empathy and awareness of their developmental needs. So let's go ahead and switch gears to toddlers and preschoolers. So as children transition from infancy into toddler and preschool years, we begin to actually see major leaps in both physical and emotional development. Toddlers typically between 1 and 3 years old, and preschoolers kind of range from 3 to 6 years old. While they still look and act differently from adults, their cardiovascular system actually starts to resemble ours a bit closer. Their heart and lungs are stronger than in infancy, but again, keep in mind the respiratory musculature is still very immature. So even though they're running around building stamina, they can't sustain deep or rapid respirations for long, okay? That means they get sick, they can decompensate rather quickly. Their immune systems are also just starting to build their own defenses. So things like colds, minor infections are common as they begin to interacting with other children more frequently. This figure actually shows a typical toddler who's in a stage marked by exploration, okay, by movement and increasing independence. Toddlers are constantly on the move. They're walking, they're climbing, they're grabbing. They're really testing their boundaries, okay? And the parents' boundaries. They're curious, but their motor control is still developing, which is why falls and injuries are common in this kind of age group. From a responder's perspective, understanding this behavior really helps us anticipate not only how the child might have gotten hurt, but also how they'll react to us. Toddlers may be fearful, resistant to touch, or easily overwhelmed during an EMS call. So gentle reassurance and keeping a parent close can go a long way in calming them down. So now let's kind of talk about a little bit more about their vital signs for this age group, right? So the typical vital signs in terms of pulse for this age group, again, preschoolers from 3 to 6, their pulse 80 to 140 beats per minute, right? Respiratory rate 20 to 25 breaths per minute, and then their systolic blood pressure 80 to 100 millimeters of mercury. So as these preschoolers, again, continue to grow, there's really a major shift in how their body and brain will work together, okay? Their lung development continues with an increasing number of alveoli to support their rising oxygen needs. However, even though the lungs are maturing, the musculature is still relatively weak, so they may fatigue quickly with respiratory distress. One big milestone during this stage is actually the loss of passive immunity. Okay, that means they start catching every cold and stomach bug that their immune system builds a resistance. Okay, but it's actually a normal and really necessary process. Another key area of development is the neuromuscular growth. Okay, so they're learning how to run, jump, catch a ball, and do more precise tasks like stack blocks or hold a pencil with a better grip. Okay, this blend of gross and fine motor development helps build coordination, helps build confidence, and overall strength. Okay, so also in this stage where toilet training becomes a focus, while most toddlers are physically ready around 12 to 15 months, many don't master it until around 28 months on average. Okay, so as an EMT, knowing whether a child is toilet trained helps you anticipate issues with incontinence, anxiety during assessment, or even signs of neglect if expected developmental milestones are actually missing. Psychosocially, for this group is really exciting and challenging phase for this group. Toddlers and preschoolers are really navigating the developmental stage called autonomy versus shame and doubt, right? They're learning independence and trying to assert control over their environment. So think of the child who insists on dressing themselves or pouring their own juice, right? Even if it makes a mess, okay? So success in this stage builds confidence and autonomy, okay? But constant criticism or restriction can actually lead to feelings of shame and feelings of hesitation, okay? So by 3 years old, most kids have mastered basic language skills, okay? So they're not just telling you what they want, they're telling you stories, asking why, and even making jokes, okay? Socially, they begin playing with other children, learning to take turns, following rules, and being part of a group, okay? They also begin to understand concepts like cause and effect, which really plays a role in behavioral learning. And by watching adults or older siblings, they start to recognize gender identity and roles. As an EMT, it's important to respect their growing independence. So when you're assessing, you need to, and treating, you need to offer choices when possible, involve them in simple decisions, and always speak to them at their level, not just to the caregiver. So now we're going to move into school-aged children or the school-aged years. Okay, this is going to span from about 6 to 12 years old. Okay, physically these kids are gaining about 4 pounds and 2.5 inches to their height per year. It's a steady, healthy pace of growth. And most kids at this stage are active, they're resilient, and they're developing strong immunity. Okay, their baby teeth. The baby teeth begin to fall out, and the permanent teeth come in. Another visual sign that their bodies are maturing. Neurologically speaking, the brain is very active. Both hemispheres are really firing on all cylinders, and the cognitive development really starts to accelerate. As EMTs, this is a great age to involve the child in their own care. They can describe what they're feeling, follow complex instructions, and are often really eager to help. Okay, so when you respond to a school-aged patient, don't assume they need everything explained through the parent. Okay, speak to the child directly and really just explain exactly what you're doing. It's going to build trust, build a rapport, and it helps reduce the overall fear from that patient. Physically speaking, school-age children grow in fairly predictable patterns, right? As I just stated, like each year they gain about 4 pounds and grow 2.5 inches. This is a real steadily moving towards adolescence. Their brain activity increases in both the hemispheres, right, leading to really significant improvements in their logic, in their memory, and their overall reasoning. So this is the age where you're going to see huge academic gains, but also increase in motor coordination. Kids are riding bikes, participating in team sports, and really handling more responsibilities at home and at school. One key development sign is, again, the loss of those baby teeth and, the introduction to their permanent teeth. This is going to align with improved nutritional habits, self-care routines. And as an EMT, it's helpful to remember that while kids at this age may appear mature, they're still emotionally vulnerable, okay? They may try to be brave, but really pain, fear, and embarrassment, especially in public, can escalate quickly. So you really need to always approach them with reassurance, patience, and above all else, like just clear, honest communication. So psychosocially for this age group, so this specific age group is navigating real complex emotional kind of terrain, right? They begin developing moral reasonings at this stage. Initially, it's about pre-conventional reasoning, okay? Avoiding punishment and seeking reward, okay? Then they shift into conventional reasoning. This is where their choices are driven more by peer approval and a desire to follow social rules. Okay, if you begin exploring what is called post-conventional reasoning, guided by personal sense of ethics and fairness. But this is also when self-concept and self-esteem take root. Children are going to start asking, am I good at sports? Do people like me? Am I smart? These questions really shape how they view themselves well into adolescence. So as EMTs, we may not see the full psychosocial context, but we can contribute positively in moments of stress by affirming their courage, giving them control, like choosing which arm to take a blood pressure on, and explaining things in a way that makes them feel not only seen, but really respected, okay? So now let's move into adolescence, okay? So, or the teenagers, right? So an adolescent or teenager typically defined as 12 to 18 years of age. It's really one of the most complex and emotionally charged stages of development. So first, let's take a look at their vital signs, right? So they begin to level out into adult ranges. A healthy adolescent will usually have a pulse between 60 to 100 beats per minute, respiratory rate 12 to 20 per minute, and a systolic blood pressure between 90 and 110. Okay, but don't be fooled by these adult-like numbers. Okay, so these patients are still undergoing rapid internal changes, right? The body is going through kind of a 2 to 3 year growth spurt, which begins at the extremities, and hands and feet, and it's going to finish with the torso. Girls, the females, typically finish their growth earlier, often by about 16, while boys will continue until around 18. By the end of this period, muscle mass, bone density are kind of near adult levels. So even though they look grown, they're still figuring everything out, both physically and emotionally. Um, Adolescence, right, it's going to bring also a big surge in hormonal activity, okay? And this triggers a cascade of like secondary sexual characteristics. So during this phase, we see the growth of pubic and axillary hair, changes in voice depth, and a development of external reproductive organs. So in girls, increased fat deposits in the hips and the breasts signal the body's preparation for fertility, and menstruation or menarche. Often begins by the middle of this period. Okay, in boys we have sperm production begins, and they typically continue growing larger than girls, often reaching their peak height about at the age of 18. We may also see acne, growth spurts, increased muscle mass. These physiological changes are normal, but can be distressing to teens, especially when they feel their development is kind of out of sync with their peers. Okay, so in EMS, these developmental differences really remind us to approach adolescents with a heightened sense of privacy, dignity, and awareness that their bodies are changing rapidly, and they may be especially self-conscious. So let's kind of take a deeper dive into the emotional and social kind of roller coaster, if you will, of adolescence. One of the biggest shifts is a desire for independence, a desire for privacy. Okay, teens begin to form their own identity, which may involve trying on different appearances, beliefs, social groups. Okay, this can actually lead to conflict with parents or guardians, not necessarily because they're just trying to be defiant, but because they're exploring who they are outside of those actual relationships. Many also begin to develop strong emotional bonds with peers, which can really greatly influence their decision-making process. That peer influence, paired with hormonal surges and a still developing frontal lobe, often actually results in what we call risk-taking behaviors: smoking, experimenting with drugs, engaging in unprotected sex, or just other random unsafe choices. So for EMTs, this means you need to be a neutral, respectful adult figure, someone who can gain their trust, especially in these sensitive scenarios. Avoid being judgmental. If the teen feels safe, they're more likely to be honest. And that can make all the difference in your clinical diagnosis and your care and treatment. So this slide specific gets to kind of the heart of the mental and behavioral health risk in these adolescents. Okay, so around the ages 14 to 16, we often see a peak in antisocial behavior, peer pressure, and experimentation with things like alcohol, vaping, and sex. Body image concerns turn into eating disorders, and feelings of inadequacy or loneliness may actually lead to depression. Sadly, this is also the age group with one of the highest risks of suicide, especially when support systems are weak or stigma just prevents them from seeking help. In your EMS role, it's vital to recognize emotional red flags. Has the teen expressed suicidal thoughts? Are there signs of self-harm? Has their demeanor changed dramatically? Okay. If they seem physically stable, your calm presence and careful questioning could actually be the first step towards getting them the help they actually need. Lastly, don't forget that during your assessment, teens actually will withhold information in front of their family. So do your best to always try to speak with them alone for a few moments if the situation allows for it. All right, so moving forward, now let's go ahead and step into early adulthood, which spans from age 19 to 40. Okay, so by this point, the body has reached full physical maturity. Most early adults are at their peak performance between ages 19 and 25. This is when the patient's strengths, reflexes, reproductive health are all functioning at their best. Vital signs are similar to those seen throughout the rest of adulthood. Again, heart rate 60 to 100, respiratory rate 12 to 20, systolic blood pressure about 90 to 120. So as EMTs, we don't expect wide variability in vitals for this age group, unless there's an underlying medical issue. But even though they're physically strong, this group isn't immune to illness, injury, or stress. Okay, many early adults engage in risk-heavy occupations: construction, law enforcement, firefighting, or live lifestyles that carry exposure to trauma, substance abuse, poor self-care. So while their bodies may be resilient, it doesn't mean they're invincible. So like I said, while the adults may be physically in their prime, right? This stage is often filled with major life transitions, getting married, parenting, career building, and even returning back to school. These milestones can bring a lot of personal fulfillment, but they also introduce a significant amount of stress. So from the EMT perspective, we often encounter early adults not because of their age-related health, but due to trauma, lifestyle factors, or mental health crisis. This is also when habits, both good and bad, become kind of solidified. Smoking, poor diet, lack of sleep, while might not feel like a big deal now, but they set the tone for later health outcomes. And even though they're often psychologically stable during this period, don't assume they're immune to anxiety, to depression, to burnout, especially if they're juggling work, family, financial pressures. Okay. So when treating early adults, your awareness of these kind of invisible stressors is just as important as your physical assessment. Now let's go ahead and move on to our middle adulthood. Okay, this is going to cover the ages of 41 to 60. Right, this is when the cumulative effects of lifestyle choices and aging start really to become more obvious. Vital signs remain the same within the adult norm: pulse 60 to 100, respiratory rate 12 to 20, systolic blood pressure a little higher, 90 to 140. But again, we begin to see a rise in chronic conditions. Many people in this age group have been diagnosed with hypertension, diabetes, high cholesterol, or early signs of heart disease. Their hearing and vision may begin to decline. Menopause typically occurs for women between their late 40s, early 50s. This is also when you may notice increase in fatigue, weight gain, difficulty maintaining previous fitness levels. As EMTs, this is the age where you should increase your suspicion of cardiovascular issues, even in patients who appear relatively healthy. So don't be surprised to find an undiagnosed medical condition during your actual routine assessments. As people continue to go through middle adulthood, age-related changes become more noticeable. One of the most common transitions for women is going to be menopause. As I stated, typically occurs in the late 40s, early 50s. This marks the end of menstruation and reproductive capabilities. And it often comes with symptoms like hot flashes, mood changes, and hormonal fluctuations. At the same time, both men and women may actually begin to experience weight management issues, elevated cholesterol, and reduced cardiovascular efficiency. Many of these changes can actually be managed or even prevented, right? So with a healthy diet, consistent exercise. But again, not everyone has the time or the resources to do so. That's where EMS actually plays a big role. So when responding to patients in this age group, it's really important to evaluate for undiagnosed or poorly managed chronic conditions, especially if they're presenting with vague complaints like fatigue, dizziness, chest discomfort. They may be the first signs of serious issues like diabetes, cardiac disease, or even worse, cancer. Psychosocially, middle adulthood is really the high pressure stage of life. Many individuals are juggling multiple roles, caring for aging parents, managing careers, preparing their kids for college, and really trying to plan for their own retirement. This can lead to emotional strain, anxiety, and possibly depression. So there's also something called empty nest syndrome. This is a sense of kind of overall loneliness or identity loss when the children leave home. While most middle adults have the emotional and spiritual resilience to adapt to these changes, others experience significant distress. So, from an EMT perspective, don't underestimate the impact of these psychosocial factors on physical health. Someone may present with vague symptoms like headache, fatigue, lightheadedness, but at the root of it all, it could just be a stress-related or even a silent cardiovascular event. So these patients may not tell you they're overwhelmed, but you'll see it in their vitals, their effect, their hesitancy to seek care. So be patient, ask good questions, and really offer reassurance whenever it's possible. Now, the final phase of the lifespan development, the older adulthood. Okay, so this is going to begin at age 61 and goes up. One important thing to note right away is that life expectancy is actually rising. So, thanks to the advancements in medicine, diet, public health, many people now live well into their 80s, their 90s, or beyond. Okay, in the early 1900s, the actual average life expectancy was just 47. Today is closer to 78, and many older adults are still active, independent, mentally sharp. However, aging really impacts every system in the body, and those changes influence how we assess and how we care for patients. Some older adults may be extremely fit, while others may have multiple chronic conditions, limited mobility, or cognitive impairments. That's why this stage of life requires nuanced and individualized care. So when we walk into a scene, we need to assess not just the patient's complaint, but also how well they're functioning overall, both physically, cognitively, and even socially. Now let's break it down. Let's look at the cardiovascular system, right? So this is one of the most significant impacted body systems of our older adults, right? So as we age, the heart muscle naturally weakens and becomes less efficient at pumping. Okay, a common condition we see in this age group is called atherosclerosis, right? This is the buildup of cholesterol and calcium in the walls of the artery. This is going to lead to narrowing or blockage of blood vessels that contribute to high blood pressure, heart attacks, and even strokes. Okay. Um, in fact, over 60% of people over 65 have some degree of atherosclerotic disease. So we also see a decline in heart rate and cardiac output, meaning the heart isn't able to adjust as quickly to stress or exertion. In the pre-hospital setting, this becomes especially important when you're evaluating an older patient with vague symptoms, again, like fatigue, shortness of breath, or dizziness. Okay, because these might be the only signs of a cardiac event. So these subtle clues matter more as a patient's age, and you may not see the classic chest pain or those obvious distress signs and symptoms. Now let's look at the respiratory system. Okay, so aging actually causes several structural changes here as well. So first, the airway is actually going to become wider, but that doesn't necessarily mean that breathing becomes easier. In fact, the elasticity of the lung is going to decrease, and so does the surface area of the alveoli, where gas exchange is taking place. That means breathing becomes more labor intensive. Okay, so as a result, older adults may tire more easily or become short of breath with activity. Another issue is the intercostal muscles and the diaphragm. Okay, so right, these are the major muscles of breathing. So they're going to weaken with age, and this reduces overall lung capacity. This decline is slow and often goes unnoticed until a serious illness like pneumonia or COPD flares up. When evaluating an older adult, you need to pay close attention to their respiratory rate, their work of breathing, oxygen saturations, because even slight deviations can be serious, especially when they're layered on top of others and on top of other chronic illnesses. So in addition to decreased lung capacity, the chest wall itself becomes more rigid and fragile due to the calcification of the ribs, right? This makes the mechanics of breathing much harder and increases the risk of rib fractures during trauma. And so even a minor trauma like a fall or just forceful coughing. On the top of that, the cough and gag reflex diminishes. So now there's going to be an increase in the risk of aspiration, particularly during swallowing or vomiting. Okay, the cilia in the airway that help move mucus and debris also decline, which makes it harder to clear secretions and leads to a higher risk of respiratory infections. In EMS, this is why you really need to be cautious when treating geriatric patients with even mild respiratory complaints. Their reserve is limited, so they may decompensate very quickly. So gentle airway management through auscultation and an early oxygen assessment are really important in treating this population. Aging also impacts the endocrine system, right? So it's one of the biggest changes is really a reduction in their insulin production of the pancreas, okay, and a slowing of glucose metabolism. This puts older adults at greater risk of type 2 diabetes or worsening glucose control if they already were diagnosed. So you may also see changes in sexual hormone levels, but unlike women who go through menopause, men often continue to produce sperm well into old age, although their libido and sexual function may decline. Okay. Hormones regulating metabolism also decrease, which can contribute to weight gain, fatigue, temperature sensitivity. As EMTs, we really need to be alert to the signs of hypoglycemia, altered mental status, and really any unusual behavior, especially in our diabetic patients who may not be fully aware of their condition's current status, right? You also need to keep in mind the endocrine disorders often present subtly in older adults. So you really need to be thorough, even if the chief complaint seems minor. Now the digestive system, okay? So the digestive system also changes significantly with age. And these changes can impact nutrition, hydration, and overall general well-being. First, the taste bud sensitivity decreases, especially for salty and sweet flavors. Combined with a diminished sense of smell, food can seem bland or just unappetizing, which actually may lead to poor nutrition. Saliva production declines, making it harder to chew and digest complex carbohydrates. Tooth loss or ill-fitting dentures can further impair eating. So inside the GI tract, gastric and acid secretions are going to drop. Peristalsis slows down, and that's the movement that pushes food through the intestines. But this often leads to constipation, bloating, decreased appetite. Also, your blood flow to the intestines may actually be reduced to as much as 50%, which is going to limit the body's ability to absorb nutrients. These changes may seem minor, but in an older adult who's already so fragile, they can contribute to dehydration, malnutrition, or a bowel obstruction. So for EMS, this is important, right? If an elderly patient reports abdominal pain, it really should never be dismissed because even mild complaints could indicate something vastly more serious. So now moving on, let's go to the renal system. Okay, so the renal system plays a major role in maintaining fluid balance and removing waste products from the body. As we age, the kidneys are going to shrink in size to about 20%, or by 20% rather, and their filtration abilities can decline to as much as 50%. That means medications, toxins, waste products can build up more easily, especially if the patient is dehydrated or sick. These changes are primarily due to reduced blood flow to the kidneys and a decrease in number and efficiency of your nephrons, which are your filtering units. This also impacts the kidney's ability to conserve fluids. So older adults are more prone to dehydration and electrolyte imbalances. As EMTs, we really need to be cautious when patients present with altered mental status or weakness because they may be signs of renal dysfunction, even if they're not complaining about their urinary system. And remember, renal issues can intensify the effects of medications, leading to toxicity. Now moving to the nervous system. So the nervous system undergoes immense changes with aging, okay? And they can directly influence how older adults function and respond to injury and illness. By age 80, the brain has typically shrunk in weight by 10 to 20%. So although the number of neurons declines, the brain remains adaptable, thanks to the increase in connections between the remaining neurons. So unfortunately, however, reflexes will slow, reaction time increases, and cognitive processing actually may take longer. You may also notice changes in sleep cycles. Many adults no longer sleep through the night, but instead nap during the day and stay awake into the early mornings. So these are often normal changes, but when coupled with confusion or disorientation, it's important to differentiate between dementia, delirium, and acute illness. So as EMTs, don't assume confusion is just part of getting old, right? Always investigate, especially in the presence of fever, trauma, or abnormal vital signs. An altered mental status in a geriatric patient could really be the first and only sign of a serious medical condition. Um, Here's a critical structural change in the nervous system. Okay, it's called brain atrophy. Okay, this actually creates more space inside the skull, especially in the subdural space between the brain and the dura mater. This space increases the risk of subdural bleeding, especially when the bridging veins get kind of stretched or torn. Okay. The scary part is that even a minor head injury, such as like bumping the head in a fall, can lead to slow, progressive bleeding. Okay. The patient may not show signs or symptoms for hours or even days. So if an older adult had a fall, even if they are alert and oriented when you arrive, you really need to ask about anticoagulant use and really monitor closely for any delayed signs of intracranial pressure, like confusion, vomiting, or headache. This is really one of the key differences in geriatric trauma. The injury may be subtle, but the consequences can be life-threatening if we don't catch it early. Uh, In addition to changes in the brain itself, aging also impacts the peripheral nervous system, the PNS. Over time, nerve endings begin to deteriorate, which slows reaction times and impairs sensation. So that's why many older adults don't feel hot surfaces, they don't feel sharp objects or wet floors as quickly as the younger people do, which increases their risk of burns, injuries, and falls. This loss of essentially a kinesthetic sense or just the awareness of body sense and body position makes balance more difficult, and it really contributes to gait instability. Combine this with weakened muscles, slower reflexes, it's not surprising that falls are a leading cause of EMS calls in this population. As EMTs, it's important to ask about falls, ask about mobility issues, even if they aren't the reason for the 911 call. A simple stumble might be a sign of an underlying neurological issue or a medication side effect. So always think big picture with your older patients because, again, one symptom often connects several underlying systems. Come on, hit the next button. Oh, no, no. Standby team. Okay, let me go in. Okay, there we go. As the sensory systems age, several changes actually affect patient communication and safety. Okay, so first, vision changes. Pupils become smaller, light response slows down, and the lens of the eye actually thickens, reducing the ability to focus on close objects. There's also a narrowing of peripheral vision and an increase in sensitivity to glare, which makes driving or navigating bright environments more difficult. Hearing loss, right? So this is actually about 4 times more common than vision loss in the elderly. Many older adults lose the ability to actually hear high frequency sounds, including certain consonants in speech, which can make conversations really difficult to follow, especially when it's a noisy environment. For EMTs, this is a key moment to actually slow down, to face the patient, speak clearly, but not to shout, and check whether they use glasses or hearing aids. So just because someone looks confused doesn't mean they are. They may just not be seeing or hearing you that well. Why does this not want work? Now we shift to the psychosocial aspect of aging, right? So something that really is just as critical as the physiological changes. First, it's really worth noting that 95% of older adults live at home, so not in assisted living or nursing home. Many actually remain active and independent well into their 70s and 80s. But that independence can actually mask serious financial struggles, social isolation, or cognitive decline. Many older adults face difficult decisions like choosing between buying medications or buying groceries. Others may suffer emotionally from a loss of a spouse, close friends, or a community role. The shift from being someone who gives care to someone who receives it can be emotionally challenging. As EMTs, we should approach these patients with empathy and patience. They may be scared, not just because they're sick, but because they're worried about losing their independence or becoming a burden to their family. So simply treating them with respect and dignity really goes a long way. So it's often the part of care that they are going to remember the most out of the interaction. Finally, all right. So in this final section on older adults and this whole chapter, we address one of the most profound aspects of aging, right? The increasing awareness of one's own mortality. Okay, for younger people, death feels distant, right? It's an abstract concept, but for many older adults, especially those in their 70s, 80s, or beyond, loss is more frequent and personal. The death of a spouse, a lifelong friend, or a sibling can cause deep grief and serve as a reminder that their own life is kind of nearing its end. These events can contribute to depression, withdrawal, or even physical decline. So social support becomes essential. Yet unfortunately, it's really lacking. For some, their children have moved away, or their family may no longer be actively involved in their care. And while many older adults thrive with strong networks and fulfilling lives, we must be alert to those at risk for emotional isolation, financial insecurity, or elder neglect. As EMS providers, a few extra minutes spent listening and showing compassion can really have a great impact, more so than any medication that we can possibly administer. So that is the end of the chapter. See you next time.